Here's what your therapist didn't tell you about your eating disorder, particularly anorexia nervosa. So, majority of therapists tend to use cognitive behavioral therapy as a means to treat anorexia nervosa. If you're not familiar with cognitive behavioral therapy or CBT, what the approach is it mainly focuses on your conscious mind. So we take a look at your thought processes and we see how this is affecting your emotional regulation and what's going on in terms of your emotionality. And then that can worsen or exacerbate your behavior. So for instance, if you're thinking, I'm so fat, I'm so disgusting, I'm so terrible, all of these awful things about you, then you're going to start to feel really negative about yourself. And in return, that's going to worsen your restricting behaviors or other compensatory behaviors such as over-exercising. So what ends up happening is, at least with Dr. Fairbairn's theory of cognitive behavioral therapy, specifically for eating disorders, targets and focuses on those thought processes that affect one's behaviors that contribute to their self-starvation. And this can be wonderful as a means for stabilization. So I tend to use CBT as a means to help with stabilization when someone is coming in to see me struggling with anorexia and they are progressing in terms of their compensatory behaviors. So they're losing weight, they might be severely underweight to the point where they might even need to be hospitalized. So what we tend to do is, with an interdisciplinary treatment team, so with family doctors, with dietitians, family therapists, so on and so forth, a team comes together to support this individual. My role is to help with stabilization and then continue that process. The problem is after someone is stabilized, then there's no follow-up in terms of what to do next. And then this is problematic because many people who actually go into remission and are not engaging in restrictive behaviors, not over-exercising or starting to gain weight, then this level of success is only short-lived. So what I usually do after the stabilization process is the person graduates into the psychoanalytic approach to their treatment. So what we do is we actually start looking inward into the unconscious mind, because there's so many traumatic layers that people aren't aware of, and this is a big problem. So individuals who struggle with anorexia nervosa, the issue doesn't happen once we start noticing symptoms like restricting or over-exercising, but the issue actually happens in childhood. And based on the research, what we've seen is that there's a trauma that happens before the age of 6 years old. So that can start with infancy as an example, where a mother, let's say, and a child's relationship isn't necessarily formed in a secure way, so there isn't a secure attachment. What ends up happening is an insecure attachment is formed for whatever reason. Maybe mom isn't available, maybe mom is very angry, so she's not connecting emotionally with the child, or very anxious and not connecting emotionally with the child. So something goes on where a secure relationship and attachment is not formed. Then we move on to, let's say, toilet training. So parents who are more strict, more authoritarian in their training will create unintentionally a dynamic where now the child internalizes this need to be perfect, to be structured, to be rigid, to be in control. And what is actually interesting too, with parents who are more laid back with toilet training or more disorganized, there's no structure, the child can do whatever the child does. We actually see this contribute to the eating disorder of bulimia nervosa, because attached to that is an unconscious disorganization. And there's this need to sort of lose control in the binging and the need to feel that sense of pleasure, but then to reinstate a kind of control through compensatory behaviors like purging. So what we see here, at least with anorexia nervosa, is that the trauma starts in childhood and it's before the age of 6 years old. And these are just some traumatic instances, what we call psychic traumas that leave emotional scars on the psyche. But there can also be traumas such as childhood sexual abuse that also contribute to the risk factors that are associated with the onset of anorexia nervosa. So if your therapist is not looking at the unconscious mind and peeling back those layers, looking at those defenses, bringing up in a systematic way those traumas so that you can process it, then unfortunately you're going to continue to engage in the same compensatory behaviors as you did before. It's only until you start to realize that you actually are resilient and can process that deep-rooted trauma, and the more in which you build insight, the more in which you build a healthy relationship with yourself, the more in which you don't need to restrict. You can gain the healthy weight back, so then this way you can live a very healthy life. It is a process that not a lot of people understand. It's a process that not a lot of therapists are trained in. And this is why it's so important to seek out the select few who are trained in psychoanalytic psychotherapy or psychoanalysis, which is more of an advanced version of psychoanalytic psychotherapy. So then this way individuals can actually get the help that they need. CBT is just the start. We need the psychoanalytic approach to actually get there and actually help individuals like yourself achieve your goals and help you save your life.